Okay, so it's all for training.
It's not gonna hurt though, right?
No, 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 it's not gonna hurt. It just may be a little more difficult to get your pants off.
Okay.
Hi, I'm Ram Duckworth, and I'm here to do your DHCA EMS in-house training on the Ezio interosseous infusion system for adults and pediatrics. A lot of people say to me, Ram, this is possibly the most barbaric and inhumane medical treatment I've ever seen in my entire life. And I say, hey, because I say, hey. But if you set aside the fact that it's an actual drill that you're drilling into somebody's leg, which seems like a pretty horrific thing, admittedly, what if I said to you, I have this new medical device, and I could get an instantaneous IV for you on any patient in practically any situation in a non-collapsible vein, even if they're in cardiac arrest or if they're in shock? How much would you pay for that? Don't answer yet, there's more. This system is safe, it's been proven effective for decades, and it may already be on your ambulance. So what you want to know next is, what do you have to do so that you can use this great invention? Well, if you haven't already done so, you need to find the book. That's our training book for the Ezio system. When you take a look at it, you may notice that some of the pages are missing and there's some additional pages put in. That's because we've customized the book for training for Danbury Hospital and Region 5. Now, once you've finished going through the entire book, I want you to come back to this video where, with the video clips we're going to see in a minute, we're going to go through the whole Ezio system and procedure. When you're finished with that, you're going to need to complete your quiz, and at the bottom of your quiz there's a hands-on skills check that you're also going to need to do. When you're finished with that, you could submit that and you will be qualified to use the Ezio system. Now, again, if you haven't already done it, read the book and go through your local protocols. Once you've done that, let's now take a look at the Ezio system and how it works. Okay, we're going to zoom in here on the proximal tibial insertion site. That's the normal site, just like with PALS. We identify the patella, we find the tibial tuberosity, and then we move in one-fingered width medially or to the inside. We're going to prep the area with all the materials that are contained in the kit that we're going to be carrying. Uncap the drill bit that's been attached to our drill, or we attach it to the drill, of course. It won't come that way. And then you drill in and it goes in about that easily, and it disconnects. You're going to see them holding on there, and then the drill just pops off the bit. It's just held in there with a magnet. Then the stylet unscrews just like it does with the pediatric IO. Hook it up to the extension set. We're going to get a little 3D zoom in here, and you'll see the flow. It goes in through a 15 gauge catheter, but it flows a little bit slowly, like a 22 or a 24 gauge, I've found. And then it gets right into the system, and that's that non-collapsible vein that we're talking about. Now let's take a look at this on some real volunteers.
All right, Scotty.
I'd rate that a 2.
What?
Yeah, that's definitely a 2.
All right, now we're going to aspirate.
I can't feel you're aspirating.
Isn't that beautiful? Oh, it's coming out so easy, the blood is.
And I can tell you that the insertion was like next to nothing.
Really?
Absolutely next to nothing.
Wow. It was fast. It went in
It
really,
really
easy.
fast.
It was shockingly easy.
I've had IVs that hurt worse. I mean,
15 per 6 seconds times 10 is a minute, so that's 150 per minute.
yeah, it's a totally zero. It's totally flat. It's good and stable. I feel absolutely nothing around it.
Okay. Okay, we're going to use a technique of holding the leg, pulling gently upward while we twist clockwise.
I felt nothing. Not a damn thing.
You see, people are worried about how bad it's going to leak and bleed after you take it out.
Not.
IVs do worse than that.
Oh, yeah.
15 gauge IV, can you imagine? It would be pouring out.
You ready?
I'm ready.
Here we go. Okay, it's in.
It's a residual pain of 2 to 3 that's there.
It's right now.
Mm-hmm.
Okay. First,
Aspirate and see. Let's see if we get any
Okay.
bone marrow.
I'm aspirating that blood straight up the tubing. Can you see
yeah.
that, Bernadette?
Terrific. That does not hurt.
All right.
0, 0, 0,
I'm coming straight up.
0. No pain whatsoever taking it out. 0 pain. 0.
It's just dripping just a little.
Yeah, it's not even like an IV.
Didn't hurt.
There was no pain coming out.
Okay. You ready?
Yep.
We're in.
Wasn't bad. A lot of pressure.
I'm removing. I can see blood now filling up the catheter there. Okay, I'm going to stabilize her leg. I'm going to turn and lift. And here it comes. It's coming. It's coming out. There we go. There we go. We're out.
Does that hurt, Yvonne?
No, maybe a 1.
A 1, that was it.
That's it.
Over here.
Yvonne, you've joined this great club. The club of people who have been drilled by the IO while awake and don't even need it.
The next thing that we're going to see is the actual catheter in place and injection going through into the bone and then out into the circulatory system. And you'll see just how fast that is. Whoosh. Just push and whoosh. It goes right in that fast. Let's see that one more time. Push, and it goes right in. That's at the proximal tibial insertion site that we've been talking about. Just push and whoosh. It goes right in. It flows about as quickly as a 22 to a 24 gauge. Whoosh. But it is actually 15 gauge, and even blood products can go through it. Well, that's it, and thank you for watching. Please don't forget to complete your quiz and your skills checks. Drop it in the CME Dropbox. And if you have any questions about the EasyIO system or interosseous infusions, send me an email at romduck@snet.net. Thank you.